Hello, my name is Carrie Allen, and I am a consultant pharmacist and a certified geriatric specialist pharmacist. I'm here to talk to you today about medication expiration dates, which are something we deal with every day but don't always pay close attention to. It's not something that we want to choose as individuals. Do you want to be responsible for that ultimately? Probably not. You want to follow manufacturers' guidelines. I know sometimes, residents complain about the cost and those kind of things, or you're thinking, oh, it'll probably still work, but that's not really our choice to make. We are responsible for these vulnerable people, and we work in a highly regulated environment with inherent risk and these fragile people. So it's important to pay attention to what the manufacturer recommends. And what the manufacturer recommends is usually contingent upon properly storing the medication. So if it's supposed to be a refrigerated med and we store it out on the counter for 5 weeks, the manufacturer's expiration date on the bottom probably no longer applies. You have to pay attention to what you're doing. So make sure that you're reading the labeling that comes with medications, and if in doubt, definitely ask your pharmacist or your consultant pharmacist. I know some people have this big, including pharmacists, conspiracy theory, planned consumerism, planned obsolescence idea, whereby the manufacturer is out to get us and make us buy more medications. So they set the expiration date to be much shorter than it really needs to be. And that might be entirely true. But I can't prove it, and you can't prove it, and so what we need to do is follow what they tell us to do. Because if you go to court, that's just not going to work. So if the medication may still work, maybe. But the risk of infection, of stability, of consistency, of how it's going to work, its efficacy, that's still an issue. And unless you are going to perform your own lab studies, you have to follow what they tell you to do. The manufacturer expiration dates when they do studies are usually based on stability and possibly sterility. So how stable is the molecule? Is it still going to work? And how sterile is the preparation? Is there going to be bacterial growth? That kind of thing. Viral growth even. When in doubt, I always recommend following USP, which is the United States Pharmacopoeia 797 recommendations. That's actually a private volunteer group. It sounds very official, like it's set up by the United States government, and it's actually not. But they take very good care of doing studies, and they're very focused on sterility. There's pharmacists on the board, there's doctors on the board, and it's excellent. It's an excellent group. It's actually been adopted by many organizations in terms of following what they recommend. So, I don't know about you, but there's, your house and your car, and you clean it, and at least with me, it goes and it just gets all messy and dirty again. No matter what I do, it doesn't stay clean. A little bit linked to chaos theory. Everything tends towards chaos. It doesn't stay organized. It doesn't stay the way you want it to. Everything changes. And that's the same with medications. Things degrade. Things change. The active ingredients may change. The inactive ingredients, the binders, may change. They may become something else. They may not hold the medication together the way that they used to. And this can all affect the integrity of the medication. For example, changes in acidity can happen with medications. That may or may not be such a big deal in tablets, although it very well may. But think about an injection. What if the acidity of that changes one way or the other so that it's painful when you give it to someone? That would be a bad thing. And we can't prove necessarily, unless we're doing litmus testing all the time, that that's not happening. So make sure that you're looking at how good that vial of medication is that you're going to inject after you open it. Not just the manufacturer's date, but once you open it, once you puncture it, how good is it and for how long? The topical medications, your creams, your ointments, your eye drops, your patches, your inhalers, your nebulizers, that's really a topical because it's touching the surface of the lungs once it gets in there. There's separation of those ingredients as time goes by. We've all had a tube of lotion or ointment lay around for too long and it's changed color, or perhaps it's separated into some liquid and what looks like the cream. So keep that in mind when you're using things past the expiration date. You might not be able to see it, but it's breaking down. With liquids, there can be evaporation. So, for example, there's a lot of alcohol bases when you're making a liquid. For example, a cough syrup. So let's say you have a cough syrup that's based with a little alcohol to get things to blend together and some codeine. Well, that alcohol may evaporate off sooner or later, that teaspoon is going to be filled with a lot more codeine than it originally had in it. So we need to be real careful with stuff like that. It may increase in potency for some meds, and it may decrease. So think about every time you open the medication jar or puncture that vial, you are exposing bacteria, viruses, dirt, changes in temperature, changes in pressure, changes in humidity, and changes in light into that medication. That's going to have an effect. It has an effect on you. It has an effect on your hair. It's going to have an effect on the med. Whenever you use a product, if this were a medication and I were going to pick it up and use it, just take a quick glance at the expiration date. Check if it's been dated when it's been opened, especially for insulins or nebulizers. Understand the expiration date in relation to the open date. And there's a lot of resistance, like I mentioned, to this concept. We used to use insulin for years and it was still good. Well, it might have been somewhat good, but was it as good as it was when you first opened it? Maybe. Did it have bacteria in it? That's pretty hard to see unless it changes colors. So make sure that you're really thinking of these things as a danger to people. Somehow food is more of a big deal to healthcare professionals. I'll get nurses and stuff more upset about spoiled milk than they are about expired medications. And as a pharmacist, I wonder, why isn't injecting or ingesting an expired med also a big deal? And it could be because there's not as many obvious signs or issues with it, and there's less horror stories. We all have the, I ate bad yogurt or bad milk and, threw my guts out all night. But bad things can happen to people with medications that are expired as well, especially since some are becoming more sophisticated and delicate. We use these complicated medications that are being developed all the time. In fact, there's several very common medications where the molecules are designed only to face left. So there's no molecules in there that are active that face right. And why is that? That's because the left-facing molecules tend to bind to receptors better and things work better. They're more active. So, for example, Lexapro is like that. Zopanex, the inhaler, is like that. Levothyroxine to the left is like that. So when you're engineering things, you have to think probably not as stable as something else. Molecules are also engineered to mimic human hormones or block human immune responses, like your insulin. Byetta, that new not insulin injectable for diabetes. Humira, calcitonin, Forteo. Remember that giving a med beyond the expiration date is a medication error. Even if you don't believe it in your gut and nothing bad happened that you can visibly see, it's a med error. And it needs to be written up, and it needs to be discussed. What led us to that? Was the expiration date on one of those crimps on the lotion where it's white on white and you can barely read it? Take a little Sharpie and just shade over that, and then you'll be able to see it a little more easily. So there's ways to fix these errors. And I understand for sure that money is an issue, but it's still not our choice. You might get a resident who says, I'm not going to buy this medication. I want you to use it past its expiration date. And we can't assume that risk. You, as a licensed or certified professional, can't assume that risk. The organization cannot assume that risk. And the resident, even though they want to, can't put you in a position where they need to assume that risk. These, again, are, fragile people. Let's talk a little bit about common short dates. In pharmacy, we call them short dates, when things expire earlier than you think they probably should. The injectables. Let's talk a little bit about injectables. First of all, when you look at it, check to see if it's a multi-dose or a single-dose vial. And it'll say right on there if it's a multi-dose vial. If it does not say multi-dose vial, you have to assume it's a single-dose vial. That's how it has to go. There's also multi-use syringes nowadays, like the insulin pens or the Forteo pen. The multi-dose things and the multi-dose syringes and the vials usually are good for about 28 days, such as your Lantus or most insulins, but you have to pay attention. Some things are a little longer. So, for example, the PPD tests that people get on the skins, those are usually 30 days. Byetta, the diabetes injectable there, that's not insulin, is 30 days. Single-dose vials, we just don't use it more than once, and that's because of sterility. and even single-dose giant wound irrigation, you get the bags or the bottles. A lot of those, if you read on there, are single-dose only. For example, the acetic acid a lot of times is single-dose only, and that's because when it's opened up to air, first of all, we're exposing it to a wound or maybe a bladder irrigation. We need it to be sterile. It's no longer sterile once we're opening it up to air, so we're going to get bacteria and stuff in there. And also, acetic acid tends to break down with exposure to air. So make sure you're not using those more than once if it says single dose only. A lot of times there's no preservatives in there. And often the agents used to reconstitute antibiotics for injection are only single dose. Sometimes they're not, but then if they're not, if they're multi-dose, you have to write the date open. And if the manufacturer doesn't tell us, we're assuming about 28 days before bacteria starts growing in there and we shouldn't use it again. Now some things are shorter, like Procrit, that medication that's used to help us make more red blood cells, that multi-dose vial is only 21 days. Once you pop that open and puncture it or remove it from the refrigerator, it is only good for 21 days. Now, that's not one that you can store outside the refrigerator. I want to be clear on that. But you have to make sure you date it when you open it. Some mixes are even shorter and trickier. Novolog Mix, the 7030 Mix Flex Pen, is only good for 14 days once you've used it for the first time. And once you've used it for the first time, you can't put it back in the refrigerator. But you have to store it in the refrigerator until you open it. So what I'm saying with that is there's some things that are tricky. It should be right there with the packaging or on the pen. If not, ask your pharmacist. But you have to assume, if it's not written on there, that there's something that you need to find out. Some things are longer. Levemir is 42 days, that multi-dose vial, and Novolin N, the NPH, is also 42 days. Just as a reminder, insulin. When you get the insulin, there's a process. You get it from the pharmacy, it goes right into the refrigerator. Even though you can store it outside of refrigeration for a little while, that clock starts ticking. So you need to get it into the refrigerator to keep it stored. When it's opened, then, you can store it in your med card if you like. You could also store it, most of them, in the fridge, not all of them once they're opened, like that pen I mentioned. You date that vial the minute you open it and check the date every time you use it to make sure that it's not expired. It's always a good idea, in my opinion, to write the open date and the expiration date on there. There's even some stickers that have open and expiration. That way there's just no guesswork. You don't have to think about it. If a surveyor is watching you and you've done the math wrong, you won't have the risk of giving the medication that's expired because you'll see right on there the date that it expired. And make sure that we get rid of expired medications and reorder new in a timely manner so we don't have to use expired medications. With inhalers, some common short dates are things like Zopanex, which is about 14 days when it's in the overwrap, but if you take it out of the foil, it's only good for 7 days. So that's something to be aware of. Pulmicort's good for about 14 days. Advair is good for about 30 days. Ceravent's good for about 42 days. The combo nebulizers, the combovent of albuterol and ipratropium, you have to protect those from light, and some of the packaging will say it's only good for 14 days. And you have to think, if a manufacturer has gone through the trouble to package something in foil, and that's going to be more expensive than just stick it in a box, there's a reason why they did that. So you have to read the package and make sure that we are paying attention to what the expiration dates are going to be. And every time I point this out to someone and they say, oh, I didn't know that, I say, well, now you do, but I also say read the package because it's usually right on there. And read those ancillary labels that the pharmacy sticks on. We don't like sticking those things on any more than you like looking at them, but they're there for a reason, and actually by state law in most states. So they're there to give you information. Make sure that when you remove something from the foil, not only are you dating on the foil, like in the case of Zopanex, or on the actual discus in the case of Advair and Ceravent, that you're writing the person's name on the actual inhaler, by the way, because we can't do that in pharmacy for you, because once you rip that open, it starts the clock on the expiration date. And just backing up for a minute, Proventil and Ventolin, these are albuterol inhalers, the little HFA inhalers. In most cases, it's about 12 months. So you still want to date when you're using that. In some cases with the Ventolin, there are some packages that will say if it's removed from the overwrap, then it's only good for 6 months. So again, you want to pay attention to that. And you want to think, if someone left and went out to the hospital, their Advair isn't good for the 30 days that they are there at your facility total. It's just good for 30 days. So if they were here for 15 days, went out to the hospital for 15 days, that Advair died while they were out. That's what happened. You need a new package. With refrigerated eye drops, nasal sprays, and other stuff, nasal sprays like your calcitonin for your osteoporosis, your Fortical, we manage like insulin. So you store it in the fridge till you need it. Then when it comes out, it's good for about 30 days. One of those is good for 31 days, and I can't remember which one. But again, read the packaging. Eye drops such as Zalatan for glaucoma, again, you do it sort of like insulin. You take it when you get it, you stick it in the fridge. When you're ready to use it, you take it out. You can store it in your med cart. It's good for 42 days after it's been removed for refrigeration and used. Phenergan, I'm just going to mention because it's confusing. The expiration date is the manufacturer's expiration date, whether it's a suppository or an injection. But the suppository goes in the refrigerator. The injection actually does not go in the refrigerator, just so you know. Pulmozyme, I always like to mention because the company that makes it is futuristic sounding. It's Genentech. So you just know. That's a delicate med right there. It's made by Genentech. The expiration date is stamped on the ampule, but it is contingent on staying refrigerated until use. That's a very delicate molecule. It absolutely has to be refrigerated, and it's very expensive. Eye drops are just tricky. I'm going to tell you right now that the safest and most effective thing to do is read the box. If the box doesn't give you much guidance, I usually say go to USP 797, but in the case of eye drops, it doesn't have much guidance either. The safest thing to do if we're looking at bacterial growth, and that's really what we should be looking at, we don't want to be giving people eye infections, is to get rid of eye drops after 30 days when they've been opened for everything unless the manufacturer specifies otherwise, such as Zalatan. That is basically what has come about from a lot of studies in Europe, not here in the United States, but they did a lot of bacteriological studies and found that right around 30 days, there's bacteria growing in there. Because you know when you put eye drops in, no matter how careful you are, people blink, you can touch their eyelashes. This is a mucous membrane. You might touch their eyeball, even though you're not supposed to touch their eyeball, and you're supposed to throw it out if you do. People don't always do that, or they don't always notice. So we are worried about bacterial growth there, and these people, have delicate, fragile vision as it stands. If you were looking to be a little bit less conservative, you can probably go or get away with 90 days, unless, of course, the manufacturer specifies otherwise, like with Zalatan, if it has a preservative in it. And you can tell that because usually on the box it'll say preservative, blah, blah, blah. Preservatives usually start with benz, like benzalkonium, or you'll see the initials all in caps, the acronym BAC, or ADBAC. If there's a preservative in there, we've got something in there that's bacteriostatic. It's not bactericidal, meaning it's not going to kill bacteria in there. It means it's going to help keep bacterial growth down. Not gone, down. So that's something to think about. If something has no preservatives, again, I usually go with 30 days unless the manufacturer specifies otherwise. Suspensions, those things that you have to wait for when you go to the pharmacy for your kids where they shake it all up, tell you to store it in the refrigerator and make sure that you shake well before you use it. That's when you have little tiny particles that are mixed and suspended in water. And they're not stable by definition, or they would already come as a liquid. You wouldn't have to stand there in the pharmacy line waiting for us to mix it. They're usually good for 10 to 14 days. And then they're really no longer stable. They're probably less effective. And in some cases, things can become toxic, honestly. There's some cases of tetracycline where that has happened. So when things are less effective, however, and we're still giving them, let's say you've decided, I kept this drug suspension around for 2 weeks, and now they've got another infection. I'm just going to go ahead and use it till the pharmacy sends me stuff. You might be promoting drug resistance because what you're doing is you're basically doing a survival of the fitness test of those bugs with this slightly less effective drug. And the ones that are left around are getting stronger and stronger. And that is just not something I made up. You can look that up anywhere. Drug resistance is growing. Some examples of suspensions are Tamiflu. We've all seen a lot of that lately with the influenza scares. That's good for about 10 days. Valsite oral solution, that's actually a solution, it's not a suspension. Even though manufactured by the manufacturer, we're not shaking it up ourselves, it's only good for 49 days after we've started using it because it tends to break down. Keflex suspension is a common one that's good for about 14 days. So always look at those labels to know how long it's good. With these expiration dates, learn them, live them, and do it. Abide by them. When in doubt, read the package. If you're still in doubt, ask the pharmacist. Sometimes we have to look 3 or 4 sources if it's not completely clear, to be perfectly honest. And if you have questions, please contact us. Sometimes expiration dates are much more confusing than they need to be, and we can find a consensus. So thank you very much for your time.